Hello, I'm Bandaging. Still remember we had learned about types of wound, how does a wound heal, and management of wound. Today, we are going to continue the chapter, dressing and bandaging. Before we start the lesson, let's recap the previous chapter about wound and wound management. Wound is injury causing the damage to the skin. Also, we have learned the type of wound, which are incise wound, laceration, abrasion, contusion, puncture wound, stab wound, and gunshot wound. Furthermore, we also learned to stop bleeding, which is apply pressure and elevate the injured part above the heart level. And also have learned some of the functions of dressing, which are prevent infection and apply pressure on wound. Dressing must be in clean and non-fluffy material. And most importantly, never touch the wound with your bare hands and put on PPE before assess the casualty. Roller bandage is used to support to injured joint, secure dressing in place, maintain pressure on wound, and limit swelling. For elastic roller bandage, it is used to apply support to a strain or sprain, and is wrapped around the joint or limb many times. It should be applied firmly but not too tight to cut off the blood circulation. Besides, cotton or linen roller bandage are used to cover gauze dressing. They will come in many different ways and in place with tape, clips, or pins. Moreover, there are two types of tubular bandage, which is gauze tubular bandage and elastic tubular bandage. Gauze tubular bandage is used to secure dressing on fingers and toes, and it is put over the injury using a special applicator, while elastic tubular bandage are sometimes used to support injured joints such as the knee or elbow. Next, one of the types of bandage is triangular bandage. Triangular bandage may be supplied in a sterile or clean pack. Triangular bandage may also be used as dressing to cover lash wounds and burns. It can be used as sling to support, elevate, or immobilize upper limb. The bandage can be folded as narrow bandage or broad bandage to immobilize and support a limb, or to secure a splint or bulky dressing. After knowing the function of triangular bandage, let us learn how to secure a triangular bandage. When securing a triangular bandage, always use a reef knot. Reef knot is secure and will not slip off easily. It is easy to untie, and it is more comfortable for the casualty. Remember, do not tie the knot around or directly over the injury, because this may cause discomfort. To tie a reef knot, first, you need to hold the both ends. Pass the left end over the right end and loop the left end. Pass the right end over the left end and loop the right end. Pull the ends to tighten the knot. This is reef knot. To untie a reef knot, pull one end and one piece of bandage from the same side of the knot firmly, so that the piece of bandage straightens. Hold the knot and pull the straightened end through it. This is how we untie a reef knot. You should do a sling to protect an injured arm and prevent it from further damage. There are two types of sling, arm sling and elevation sling. Both can be made using the triangular bandage. Arm sling hold the arm in horizontal or slightly raised position. It provides support for upper arm injuries, wrist injuries, casualty who can bend the elbow, and a rib fracture. An elevation sling hold the arm in a raised position with the fingertips touching the casualty's shoulder. It can help to support the arm, control bleeding from the arm, and also help to reduce swelling. To make an arm sling, first, you need to ask the casualty to support their arm. Then, slide the upper end under the injured arm and pull it around the neck to the opposite shoulder. And the point should be at the elbow. Bring the lower end up to meet the upper end at the shoulder. Ask the casualty to re-support the arm. Tie a reef knot on the injured side at the hollow above his collarbone. Tuck both free ends of the bandage under the knot. Adjust the sling and extend to the top of the casualty's little fingers so that the whole arm is supported. Hold the point of the bandage and twist it until it becomes nice and tight. Then, tie in around the elbow. As soon as you have finished, check the circulation in the fingers, the capillary refill, and recheck every 10 minutes. For active children, you may also add an extra sling to minimize movement of the arm, but do not apply directly above the injured arm. To make an elevation sling, first, you need to ask the casualty to support their arm, with the fingertips touching the shoulder. Place the bandage on the injured arm. Ask the casualty to hold the bandage with his thumb. Hold the point of the bandage and tuck the base of the bandage under his arm. Bring the lower end of the bandage up across the back to meet the other end at the shoulder and tie a reef knot. And tuck the ends under the knot. Twist the point until the bandage fits closely around his elbow, then tie it around the elbow to secure it. Check blood circulation by checking the capillary refill. We check the circulation every 10 minutes. If the circulation delay, you need to loosen the bandage and re-bandage after circulation return. This is point, these two are ends, and this is base. To fold a triangular bandage, first, place the triangular bandage on a table. Take the point and fold it to the base. Next, fold bandage half to become a broad bandage. Then, fold it half again in the same direction to become a narrow bandage. Bring the both ends into the center to meet each other. Continue folding the ends into the center until the bandage size suitable to keep into the package. Lastly, keep the bandage in a clean and dry place. Amputation commonly happens in road traffic accidents. Amputation means that a limb that has been partially or completely severed. Most of the time, people may be more concerned about the amputated part. But do remember, our main focus is the casualty. You may ask the helper to search for the amputated part. Now, let us learn how to manage amputation.
When amputation happens, first, you need to control bleeding by applying direct pressure with sterile or clean, non-fluffy dressing on the wound and raising the injured part above the casualty's heart level. Secure the dressing with a bandage. You may ask a helper or the casualty to help apply pressure while we are preparing the bandage. You should apply enough pressure on the injured side, but not to a tourniquet effect. Call 999 for emergency help. Tell the emergency control center about the situation of the casualty. To prevent the deterioration of the severe part, you need to wrap the severe part in gauze or soft fabric. Then, wrap the package in kitchen film or a plastic bag. And place it in a container or sealed bag full of crushed ice. Mark the container with the time of injury and the casualty's name. Give it to the emergency service personnel.
There are many small blood vessels running close to the skin surface of our head, so any cut can result in profuse bleeding. In some cases, a wound on head can lead to a more serious underlying head injury, such as a skull fracture or may be associated with a neck injury. A stab wound, gunshot, or crush injury to the abdomen may cause a serious wound. Organ and large blood vessels can be punctured, lacerated, or ruptured. There may be external bleeding, protruding abdominal content, and internal injury and bleeding. So, this is an emergency. The management of abdominal injury is to minimize shock. Help the casualty to lie down on a firm surface, on a blanket if available. Loosen any tight clothing, such as a belt or a shirt. Cover wound with a sterile dressing and hold it firmly. Raise and support the casualty knees to ease strain on injury. Then, to arrange urgent removal to hospital, call 999 for emergency help. Check the casualty for shock. Monitor and record vital signs such as breathing rate, pulse rate, and level of response while waiting for help to arrive. Remember, do not touch any protruding intestine. Cover the area with a clean plastic bag or kitchen film to prevent the intestine surface from drying out. If the casualty becomes unresponsive, open the airway and check breathing. If he is breathing, Support the abdominal as you put him in the recovery position. Do not allow the casualty to eat or drink because an anesthetic will be needed.
Uncontrolled hemorrhage or bleeding is one of the causes of hypovolemic shock. Therefore, this is a serious condition and life-threatening. We all knew that bleeding can be internal and external. For internal bleeding, we need to immediately call for emergency help, treat for shock, and monitoring casualties' vital sign while waiting for ambulance. For external bleeding, we need to do a few steps more. First, we need to protect ourselves by putting on PPE. Then, identify the bleeding location and apply direct pressure at the same time, elevate the injured area. For emergency ambulance crew or trained personnel, they also use a bleeding control device called tourniquet when handling life-threatening bleeding to an arm or leg. To use tourniquet, first unfold the band and place it on the limb. It is important to place the tourniquet above the wound. A tourniquet should avoid apply on a joint like knee or elbow. Always remember to remove all bulky items from the pocket like keys or wallet for lower limbs injury when applying tourniquet. Then take the strap and tighten it once you have placed the Velcro strap on the limb. Turn the rod for 2 rounds or tighten until the bleeding stops and place it in the C-clip to hold the rod in place. Then, take the balance strap and place it on top of the rod. Stick the white color Velcro on the C-clip and write down the time of applying the tourniquet. After apply tourniquet, the casualty will feel very painful, but do not loosen the tourniquet. You should leave it until emergency personnel take over the casualty. As a first aider, we are not allowed to use a tourniquet to casualty, but do remember applying direct pressure and elevate the injured side is very effective to control bleeding.
In conclusion, to stop bleeding, you need to apply direct pressure with dressing and elevate the injured part above heart level. You can also use a bandage to help maintain pressure on wound, support injured joint, secure dressing in place, and limit swelling. Furthermore, arm sling is used to support injured arm and ribs fracture. An elevation sling is used to support the arm, control bleeding, and also reduce swelling. In addition, the main focus for amputation is to stop the bleeding and keep the amputated part clean and cold, and pass to medical personnel. For embedded object, you need to control the bleeding. Do not press directly or pull the object and stabilize the embedded object. Remember, you should check the casualty capillary refill every 10 minutes. If the blood circulation delay, you need to loosen the bandage and re-bandage after blood circulation return.